Hello everyone, I am Jack Friar, CAFRE Beef and Sheep Advisor in Armagh, and in today's short video we'll be looking at reducing lameness in your sheep flock, focusing on the three main causes of lameness, and also touching on a 5-point plan which should be introduced onto all sheep flocks to reduce the incidence of lameness. Lameness is a major challenge in the sheep industry, causing health and welfare problems through pain and discomfort. As well as affecting your health, it can also have an impact on the financial side of the business in terms of time and money spent on products for prevention and treatment. It can also have a negative impact on the production animals in terms of lower conception and lambing percentage due to ewes or rams not being fit, and also reduced lamb survival and growth rate potential due to poor quality and quantity of colostrum and milk production. The main causes of lameness can be split into two categories. The first category and the most common causes are infectious. These are causes which can be spread from sheep to sheep and are scald, foot rot, and CODD or contagious ovine digital dermatitis. The other category is a non-infectious, and these include toe granuloma, toe or heel abscesses, or shelly hoof. Now to look more closely at the main causes of lameness. Out of the infectious causes, scald is the most common, followed by foot rot. And these two are the same infection but of different presentation. And the primary source is from the bacteria Diclobacter pneumotosis. Firstly, looking at scald, it causes an inflammation to the skin between the claws, resulting in a red-pink infection with a loss of hair. Transmission between sheep is primarily by soil, as the bacteria Diclobacter pneumotosis can survive for at least 10 days on pasture, with warm wet weather also contributing to the cause. Other causes include dry stony ground or long tough grass, which causes trauma to the feet that allows the bacteria to penetrate the skin. Moving on to foot rot, as stated, it is a more severe presentation and occurs where scald is already established as the bacteria progresses to the hoof and causes more damage. Foot rot can be identified by its characteristic foul smell due to the infection forming when the sole and hoof wall separate. Treat cases early to ensure the chance of an effective treatment. And remember that foot rot can also cause other problems, especially at this time of year, by attracting flies. With the current warm weather conditions, this can result in blowfly strike. Lastly, looking at CODD, and as the name suggests, it is contagious and can spread very quickly through a flock. It starts with small ulcers on the coronary band where the hoof and hair meets, and the infection progresses down the hoof towards the toe, and it may result in the whole foot capsule falling off. It can be difficult to differentiate from foot rot, and a correct diagnosis is required from your vet, who will provide you with the correct treatment protocol. Though the best option if CODD is diagnosed is to cull the offender and remove it from the flock as quickly as possible to reduce the chances of it spreading to others. A good way to reduce the amount of lameness cases on your farm is to follow the following 5-point plan. 5 points in the plan fall under 3 categories. The first is building resilience within your flock through culling to help establish a healthy, robust flock. The second is establishing immunity by using a vaccination program to provide additional protection. And the final category is reducing the disease challenge within your flock by avoiding the spreading of the disease, for example in fields and high traffic areas, treating lame sheep quickly to reduce the spread of the disease, and finally quarantining incoming animals to prevent them bringing in new or more aggressive strains of disease. In order to get on top of lameness and build a resilient flock, you will need to aggressively cull persistent offenders, and weaning time is an ideal time to do so. Persistent offenders are those who always have misshapen feet and or have been treated more than once during the season. Key message from this slide is these sheep, especially those not responding to treatment, are a constant source of reinfection to the rest of your flock. Moving on to the second point of the 5-point plan in terms of vaccination. There is a vaccination available to help establish immunity by preventing and controlling foot rot. Best achievement is from a whole flock program, including your rams, and it should be timed at high risk times on the farm, for example pre-topping and housing. It should be noted that vaccination protocols can differ on each farm, therefore always seek advice from your vet before starting one. Moving on to the third point of the 5-point plan in terms of reducing the disease challenge by avoiding it. Infective bacteria associated with lameness spread easily in areas associated with high traffic, for example wet muddy handling facilities, around water troughs, creek feeders and gateways. Therefore reduce the risk of spreading by moving troughs regularly, and even consider spreading lime around gateways or troughs. Again, after treating sheep, put them onto clean pasture that has not had any sheep on it for at least 10 to 14 days. In terms of susceptibility to scald and foot rot, this can be inherited, therefore do not breed from rams or ewes which have had cases. And lastly, in terms of avoiding, research in the last couple of years has advised that hoof trimming should be avoided as an appropriate management technique, as it has been shown to increase the incidence of lameness and lengthen the time for hooves to heal, and should only be done in particular cases of lameness, such as shelly hoof. Moving on to the fourth point of the 5-point plan in terms of treatment. Ensure the quick identification and treatment of any lameness case. For treatment of individual cases of scald, a typical antibiotic aerosol spray should work, or if several sheep are affected, a foot bathing treatment. In terms of foot rot, treatment is usually a long-acting antibiotic injection, and again, a typical aerosol spray. Though before any treatment is undertaken, this should be discussed with your vet, and remember, antibiotics should be used responsibly. In terms of foot bathing for scald, the sheep should ideally be done with a walk-through bath at a slow pace, whilst for foot rot, treatment should be done with a stand-in bath to allow for a longer contact time required for the solution to penetrate the hooves. In terms of the foot bath, it should be a minimum of 6 meters in length, especially for the walk-through bath, and a solution should be 5 centimeters in depth to ensure the proper coverage of the foot. Most foot bathing chemicals need to dry on the feet for them to be effective. Therefore, sheep should stand for at least 30 minutes on a hard, clean surface before returning to the fields. Now for the last point of the 5-point plan in terms of quarantine. Incoming purchased animals, or those returning from grazing on winter grazing or common grazing, can introduce new or more aggressive strains of foot rot and CODD. Therefore, they should be quarantined for a minimum of 28 days, and during this period, their feet should be examined and a number of foot bathing treatments should be conducted to reduce the chances of you introducing new or more aggressive strains. Now to summarise some of the key points from the video. Firstly, you want to identify, separate and treat lame sheep as quickly and as effectively as possible. To treat, you also want to ensure the correct diagnosis, especially between foot rot and CODD. Always keep good records and cull any persistent offenders. Never purchase and introduce lame sheep into your flock. And always remember that the main source of infection is from other lame sheep. Thank you for watching this video, and if you require any further technical information, please contact your local CAFRE beef and sheep advisor. Alternatively, you can find more information on our website cafre.se.uk.